So, we've got a new guest on the show today on the podcast. This is Kevin's, wave to the camera. This is Kevin's first appearance on the show. So, Kevin's one of the chiros that is working at our brick and mortar facility here. Big back pain guy. Not that he deals with it, but he helps people deal with it.
Help people get out of it.
Yeah,
help people build confidence.
Yes, exactly. And big time lifter too. Deadlifts some pretty heavy stuff in some pretty weird ways. So I guess we could just start off by you kind of introducing yourself to the crowd. It doesn't have to be like a huge autobiography, but just, tell us a little bit about yourself. What do you do? What do you like? Yeah.
Well, I'm Kevin, obviously. More of just a general strength training kind of approach to lifting. So a lot of people think I love powerlifting, but like Dave said, I lift things in a lot of weird ways too. So more just kind of general strength. Big on like resilience and being able to move in as many different ways as possible. I grew up playing hockey, and that kind of got me into the gym, and then dealing with mostly like shoulder injuries actually is kind of where I got to the point of, what if I just strengthen my shoulder out of this injury and get it to be able to do everything I need to do, because I was told at certain points like, I wouldn't be able to lift overhead. So then I went, I'm going to do Olympic style weightlifting and do an overhead sport after hockey.
Yeah.
And that just kind of helped me get down the resilience rabbit hole. Graduated from University of Winnipeg with exercise science, and then went on to Canadian Memorial Chiropractic College and got my chiropractic degree, and here we are. Nice.
We'll definitely get into some of the resilience training model kind of stuff when it comes to we'll be talking about back pain today, but even like other types of injuries. But I think you kind of have to go through that to really understand how it works and why it works, because I think a lot of people have gone through that same situation of like, you hurt yourself and then you just kind of, I guess I got a bad shoulder for the rest of my life, or I guess I got a bad back, or you just almost accept it. So we'll talk about it, and we'll say why like you definitely have hope. Don't lose hope if you're hurt, right?
Whenever anyone says, no, you're never going to do that again, it's usually not true.
Yeah. Prove them wrong.
Yeah.
Prove them wrong. And yeah, I mean, Justin and I just on the last episode, we were kind of going over different health and fitness influencers saying like, here's how you have to do things. This is bad for you. This is good for you. And that just kind of falls in line with, if someone tells you can't do it, of course there's a shot that you could do it. Not everything in health and fitness is black and white. There's a ton of gray area, and we'll get into that gray as we kind of move on here. Let's start off with maybe back pain.
What about back pain? Do you want to know?
So maybe we can just talk about the complexities of it, where maybe what are some of the reasons why someone might be getting it? What can they expect? Tell us a little bit about back pain in general.
Big topic to talk about in general.
Yeah.
A lot of back pain is, some people are going to say it's not really a thing, but non-specific low back pain or just back pain in general. But what that means is basically you don't necessarily know the cause, or there's multiple kind of factors playing into it, because pain is so complex that you can't always just pin down one thing. So a lot of back pain is just so many different things going on and very misunderstood, and it just creates a lot of fear and avoidance of activities. So just breaking some of that down and working on one piece at a time can be helpful, and kind of combining things together, giving someone something where they can, see progress and build confidence in themselves and get a better understanding of the pain, so it doesn't become such a big limiter on their life. Big blanket kind of general statement, like that's going to really help treat back pain and help people deal with it and live life. One thing I always like to say is, a pain-free life is a complete myth.
Yes.
A lot of people are looking for this treatment to back pain to cure it, and a lot of people try to sell that like, you're never going to be in pain again. But to be in pain is to be alive. So understanding that and understanding like, okay, what's okay, and how much you can still do while having pain here and there, understanding like what pain is okay and how to kind of grade that yourself and understand it so you can still do your activities is just so liberating for so many people, and it gets you out of this headspace of trying to find that like cure for something and avoiding any pain at all.
Well, I think probably one of the things that almost causes that sort of like freeze moment, because a lot of people do, they hurt their back and then it's, I got to stop everything. I'm going to go lie down on the couch and hopefully wait this out, or I need maybe something to be done to me to fix it. Some of that can be fueled by the fact that back pain is so complex, but there's a lot of information out there being given to people to simplify it in almost a bad way. So there's a lot of different reasons, whether you're on social media or you're talking to somebody who's, oh, this is why you have your back pain. So I'm going to throw a couple of reasons why people might say this is why you have a bad back or back pain, and maybe you can expand on it. Okay?
I love that idea.
Okay. So, number one, you have back pain because you have a weak core.
So, not really the case.
Okay.
Most people don't have a quote unquote weak core. And a weak core isn't necessarily a cause of your back pain. Can there be some contributing factors of that? Maybe you have to do a lot of movements where you are relying on your core, and you're just working it above your capacity. The argument could be made there then that, yeah, your core relatively is not quite strong enough, or you just aren't giving yourself enough time during that task to let yourself recover to be able to do that task. So it kind of just comes down to a little bit more of a load management and working within your capacity. But by framing it as that you have a weak core, it tells that person there's something wrong with me. There's something that I can't do. There's something that now is a liability and I'm fragile and I'm just going to keep hurting my back because I have this weak core. So I need to do all these very specific movements to strengthen my core, instead of, addressing other things that are probably more important, and like load management is probably the most important thing.
Yeah.
And then that kind of leads to that. So when I get faced with, oh, I have a weak core, that's usually how I like to break it down, is more like maybe there's some capacity that we can work on to help alleviate some of those times where you're reaching that max capacity. But we also have to look at, okay, what are you doing that is maybe getting you to reach that max capacity, and how can we change that activity slightly so that it is within your capabilities of what you can do, and then as you build things up you can now do more at one time. Or maybe it's just not even quite related to that and we just need to shift focus a little bit, but that all comes down to the individual in front of me.
Yeah, I definitely want to get into a bigger conversation of the big picture of load management, because what you're talking about there is, yeah, somebody might hurt their back doing a deadlift or doing some specific exercise or activity, and immediately put the blame on that one thing. I hurt it because of that, without looking at the whole picture leading up to that point. What were you doing all day or all week before that, or all month? Maybe you've been like really overworking yourself. How was your sleep going into it? What were your stress levels like, right? The recovery side of things that you're talking about. But I guess just to kind of summarize what you're saying there, you're not just going to dead bug your way out of a
exactly
hurt back, right?
I actually just made a great Instagram post saying, if you think dead bugs are going to help you lift 600 pounds, like that's not the case. It's pretty much the synopsis of that Instagram post.
Yeah. And like, that's not to rip on like dead bugs as an exercise. There's a time and a place to use them. And there's some people where you're talking about, like, if they have a very low capacity for whatever reason, maybe they've been bedridden for a long time or are extremely frail, then that can be a really good starting point. But yeah, if you're already lifting X amount of weight and you maybe hurt yourself lifting a little bit more than that, just going straight back to the dead bugs for 3 to 4 weeks and then going right back into the lifting might not be the best.
It leaves a really big gap between that, like, okay, calming things down.
Yeah.
You don't build it up and then you go back to the activity. Now your capacity is lower and you're just going back to that activity at the same level. It's probably now going to be above your capacity again.
Yeah. Okay, so I'll give you another one. I have back pain because I have bad posture.
Myth.
Okay.
Complete myth. So, yeah, I mean, posture has not been linked to back pain, like a certain particular posture. It's more, again, kind of coming down to that capacity. What are the other factors? Are you in that posture all day? Are you really stressed, like from work, and you're sitting at your desk in one position for 6 hours at a time? Not saying that posture is bad, but that amount of time in that one posture, in that scenario where you're really stressed all the time, and then, maybe trying to go lift after that or something, and you're now kind of in that deficit capacity wise, you could view it as, to simplify things, that might have an effect. So instead of just demonizing a certain posture, you can kind of look at it as like, maybe you need to let certain tissues and structures, certain parts of your body rest by changing things around a little bit. Does that mean you need to go out and get a standing desk and stand all day? No, because you're probably going to get sore from that too, because you're not used to standing all day.
Yeah.
So just kind of, changing things up a little bit, instead of staying in one position all the time. Not demonizing that one posture, understanding like, hey, I want to be able to be in this position because that's where my body actually feels comfortable sitting here most of the time, but I just can't do that all the time. So I need little breaks from it. Think of it like, just because I like exercise, think of it like doing exercise. I'm not going to go and try to squat for 10 minutes straight because I wouldn't be able to, and I'd feel terrible after.
Yep.
I take breaks in between the sets, and that allows my muscles to recover and certain things to kind of recover to the point where then I can go and do the next set. So that's one way you can kind of view it to make it a little bit more understandable.
Yeah. I always think it's funny if I'm talking to someone who I'm working with, that like aha moment when you're like, you're allowed to slouch, and they're like, oh, it feels so much better. I've been trying to be like all upright
Straight
and
up,
stiff,
yeah.
and it just hurts more. And yeah, there's like you're saying, there's no one right way, and you can look at that across different exercises, like you're saying, take the rest during the squats. If I was to even go on a squatting program where I squat at Monday, Tuesday, Wednesday, Thursday, Friday, not breaking it up with other type of lifts, I'm going to feel terrible, right? It's on a different level and intensity, but it still adds up.
Yeah.
Yeah. Okay, I'll give you maybe two more. I think the one that I was going to expand on, but there's a lot of similarities between your last answer in terms of postures. You'll often hear people say, I have back pain because I have tight hamstring, or tight hip flexors, or tight muscles. So very specific muscular reasons, or a specific my joint is locked up sort of reason. So very specific biomechanical or physiological reasons. What's your thought on those in terms of that's why you've got back pain?
Well, this might be a little bit, I'm going to start off with like almost saying it as a loop and then kind of bring it back. So
yeah.
That could potentially be the case sometimes, with the caveat of, maybe because you don't really use those tissues, so they're tight and you avoid kind of loading into them in a certain way, you have less movement options. So then you're only using one movement strategy, and then it kind of comes back to capacity as like, okay, now you're always just loading that one area. That could be a potential explanation for it. Do I think that's really robust? No. I would say more often than not, it just kind of doesn't really have that much of an impact. But kind of going back to it and expanding on it, maybe alleviating some of that tightness and understanding like, okay, why do you feel that tightness? Might not necessarily be like they're actually tight and like physiologically shortened, because that usually is not the case. It's usually just a feeling of tightness, and the body just not wanting to necessarily go into certain ranges all the time with it.
Yeah.
Why is that happening? How can we address that to give you more movement options, so that, maybe when something like, if you're doing a lot of hinging movements, like you're doing RDLs and deadlifts and Zercher deadlifts, and you're not used to necessarily all that load and you're doing that often, having to work and pick up a lot of things at work, or sitting all day at work and just kind of in that, like I said before, maybe that decreased capacity from things and not allowing yourself to load other tissues, maybe all that can add up, and then eventually lead to that this can be one of the factors of your pain. So we need to give you more movement options to alleviate some of that workload on certain structures in the meantime, so that you can then build things up. I'm kind of going way off on a tangent, so I can't remember exactly everything that I've said, but yeah, so that's to almost like validate what someone's feeling with that is a great way to kind of loop that in, because yeah, maybe that is contributing because you don't have the movement options, because you never really load into it, because you're afraid to load into it because it feels tight and your body just doesn't want to load into it.
Yeah.
So actually building that up and relieving that could potentially help give you more movement options. And that's kind of the caveat, or I guess like nuance to that question. But yeah.
These are big overlying complicated questions. We could talk for hours about each of these, right?
The big overlying thing is that, I have a tight X or a locked up Y. It's usually not really the case, and generally as a blanket statement, I'd say like that's kind of a myth. And then all that other reasoning was like how you can kind of address it, but still, acknowledge, there's feelings there, there's certain things that are going on, and maybe this is pointing to something that could be worked on to help this situation.
Yeah, absolutely. Because movement variability can be pretty important, because you're not going to have the exact same movement every single time you do a task. If you're deadlifting in a certain way with certain technique, the moment you go out and help a friend move a couch, you might not be doing the exact same thing, right?
It's going to be very different than deadlifting a bar.
Exactly. So like to allow your body to train into different variables or different kind of movement patterns and prepare it for that is not necessarily a bad thing. So I could fully see how if someone has that perception of my hamstrings are really tight, so it doesn't allow me to kind of move a certain way, then I'm always going to default back to a different way of moving. Now I'm going to overload that movement. Now I'm going to get tired. Now it just kind of snowballs. So yeah, definitely.
And that all comes with that caveat of like, you're overloading that movement at that time. And it doesn't necessarily mean that movement's always bad.
Right.
Maybe you just need to let things calm down, build up the capacity, and then you could move that way for the rest of your life potentially, right? Yeah. As long as you're working within your capacity for that, that's totally fine. You could also just completely not address the quote-unquote tight hamstrings and just let things calm down a little bit and then build them back up and work within your capacity and come up with those other strategies where maybe you're taking a little bit more breaks at the beginning, lowering the load, lowering the volume, speed, frequency, whatever you need to do. Tons of variables you can always change, and then build that back up and go on completely pain-free or relatively comfortable for the rest of your life.
Yeah. So that leads to my final reason why someone might develop back pain, because you mentioned a couple of different variables that a lot of people don't typically look at. But somebody acutely hurts their back doing an activity. I did it wrong. I did it with poor technique. That's why I hurt my back. What do you think about that?
No.
Okay.
Yeah, so I always like to say, like, there's no wrong technique. There's no bad technique. Technique for lifts and injury is all made up. So technique is just about some theoretical efficiency. But that changes with everyone. Where are you strong? Where have you kind of historically been strong, and what muscles are you strongest with? What kind of movement patterns are you strongest with? How are your exact proportions? What do you don't know this, but like, what do your exact joints look like inside? Maybe you have certain proportions that are similar to someone else, but your joint orientations are slightly different, so you're going to move a bit different, and you have a different history of activity, so you're stronger in different ways. I could continue on with that tangent for like 10 minutes and just ramble, but all of these other factors kind of come into play, and bodies are made to move in pretty much every single way. It just kind of comes down to how much experience do you have with a certain movement, how ready are you for that movement, how coordinated are you with that movement, and how much kind of tolerance do all of the things involved with that movement have. Your brain perceiving the safeness of it, the tissues involved in it actually being able to withstand the forces. So like, maybe you're doing a preacher curl and you have it so that your elbow's raised up so that the extended portion is the most tension on it rather than like halfway down, so you're getting 2/3 of the range of motion has the biggest tension on it, and you've never done that before and you go in with a heavier weight, boom, your bicep pops or something like that, because you're not prepared for that movement in that position. Is it a bad movement? No, but you're just not quite prepared for it. If you go in with a lighter weight and build it up, now all of a sudden you can do a 1RM on it comfortably every few weeks.
Yep.
Because you've prepared yourself for that movement. I kind of lost track of where I was going and what the question was.
Realistically, movement preparation. So when it comes to specific technique, because sometimes you'll hear people just say don't deadlift or don't squat because it's just going to ruin your spine. Or other people will have a very specific like way you have to deadlift this way. There needs to be this much bending in your knees. Your spine needs to be either neutral or in like a slight arch. There can be no rounding. Very specific guidelines to how you must deadlift. And if you don't do that, now you're going to hurt yourself. So I'm scared to even try it, right? Because a lot of people exercising might not have that confidence. Big barriers are I don't want to do it because I'm afraid I'll do it wrong, or I better have a trainer there to actually coach me through all the right way before I even attempt this. And realistically, you should probably it's probably safe to attempt something within your body's means.
Yeah.
And sometimes it's hard to know what that is, right?
Yeah.
Yeah.
That's always kind of changing day to day a little bit, right? And understanding that quote unquote risk with it and those changes is helpful, and just kind of mentally coming to terms with it so you're not as afraid of it, and understanding that most times if you hurt yourself lifting, it's just going to be a little strain and you need to pull things back for a little bit and then build it up.
Yeah.
Like I've had countless strains, and same thing every time. A couple weeks where I go a little bit easier and then I just build it back up. Yeah. Depending on the severity of it, maybe it's a little bit longer, maybe it's a little bit shorter. But to blame it on a certain movement is not accurate.
Yeah.
Because like we had talked about before, movement variability, like I said before, the body's made to move in many different ways. And like you said, it's going to do tasks differently. Like when you're lifting a couch, you're going to be moving differently. So you need to be prepared for certain things. And it just comes down to that capacity.
Yeah. Yeah. Well, the preparations, just to kind of link it to something else. Mm-hmm. People will oftentimes in their day-to-days, just because of like a space or limitation, like say for example moving a couch and you got to wedge yourself in against a wall and kind of slouch over to lift it, you're forcing yourself into that position whether you like it or not. And if you've never prepared yourself for these weird awkward patterns or movements, then the likelihood of that being a lot more stress on your body in those positions is higher, because you can't just do everything completely stiffly with like this perfect deadlift technique or form, right?
Yeah.
And so, I mean, I feel like that would be like someone, let's say for example, wants to run a 10-kilometer race, and how they prepare for it is by not ever running at all. I'm just going to avoid running, and maybe I'll strengthen my calves and do some calf raises and do all of this other really good stuff for my body, but I'm not going to run at all, and I'm just going to go in cold turkey and do that 10-kilometer. That's crazy to a lot of people.
Yeah, it's insane.
If there's a specific task that you're probably going to end up doing, or you know that you're going to do, it's probably a good idea to prepare for it and train it. Mm-hmm. Right? So when it comes to deadlifts, and we'll get into like Zercher deadlifts and like Jefferson curls, which is doing a deadlift through full flexion and range of motion, a lot of times those movements are demonized, but sometimes you have to train your body in that way if you know you're going to be doing similar types of activities down the line. Yeah. So maybe that leads us to a little bit of a discussion here about Zercher deadlifts and Jefferson curls. So like, what are they? Why could they come in handy? What are some of the big issues that people have with them?
Well, so Jefferson curls, you're just keeping your legs as straight as possible and focusing on flexing through your spine. It's about rounding your back and building up, back strength through that, and kind of maxing out that range. Zercher deadlifts are a deadlift where you lift with the bar in the crook of your elbows. So
It hurts. It hurts. I learned that. It hurts.
Just like doing a back squat for the first time, those first couple of weeks are painful where the bar goes, but if you're consistent with it, you get used to it really fast.
Yeah.
But yeah, so that involves a lot more range of motion, a lot more rounding through the spine as well, to be able to lift the bar up. So again, really big focus on kind of building that resilience through those spinal flexion or rounded back movements. And just kind of building it up. There's a lot of pushback on them or fear around them because of that rounded back position, which has been demonized quite wrongly, in my opinion.
Well, what are the reasons why it's been demonized?
Well, it's been demonized largely based on dead pig spine studies where the study design was made to find a failure point in one spinal segment of a dead pig spine. Flexed back and forth beyond their normal range of motion, muscles detached until, well, loaded, kind of back and forth at like a full flexion and extension throughout 1 second until the disc failed.
Yeah.
Which is insane.
Do you remember the number of how many cycles?
I think it was like 15,000?
I think they started to see some changes around there, but there's also another number in the 80,000s to actually see like a rupture or an injury.
So the first study, it was like around 20 hours or something, I think, where there was like that rupture. And then they did higher loads like of compression and it took less time, but it still took hours. There was also another kind of more recent study where they found another failure point. I can't remember if they used pig spines or sheep spines in this one. But they just held it in flexion loaded for 2 hours. So just make sure you're not, doing a 2-hour pause Jefferson with a dead spinal segment. And I think you're good.
And so let me try to be a little bit fair here. And there's a reason to perform those studies. They're trying to learn about mechanisms of injury of certain tissues in the body. So because of that study, it's been extrapolated and wildly like misapplied to the training and health community. However, it's helpful to know that if I'm going to be bending my spine through a tremendous amount of load for a long period of time up to a failure point, things could go wrong.
Yeah, that's the risk of doing something really extreme for a long period of time, right?
Exactly.
Or if maybe, you have certain limitations, you already have some structural deficits or something where it's like, okay, now you need to be a little bit more considerate to help load manage it. So it's like, yeah, maybe you don't go absolutely crazy on it and max out on it all the time right away.
Yeah.
You allow some time to kind of build up to it.
Right. And for whatever reason, spinal flexion has gotten a lot of attention, especially when it comes to deadlifts and squats, the old butt wink sort of discussion. But I mean, if you took the exact same principles and had someone bench press until absolute failure at a really, really high weight, hopefully they would just kind of fail and be done with it. But you're likely going to see the risk of a pec rupture or a strain increase. People know that that's not a good thing, so they're just not going to bench press 500 pounds for an absolute all-around, like all-out, going to failure with it, right? Some people will.
Set after set, day after day.
Some people will just for the challenge, and that's fine. So, but most of us know, okay, I know that I have to stay within my limits and progressively increase the weight over time. I have a reasonable rep range amount of sets that I'm doing. I'm recovering in between it. I'm not doing 20,000 sit-ups in a row or whatever, right? Unless I'm trying to break a Guinness World Record or something. So why can't we take that approach to doing something through spinal flexion? It's the same thing. Exactly. As long as you're not working beyond your body's means and recovering and doing things responsibly, right?
Mm-hmm.
Yeah, so it's unfortunate that it's just been taken from the pig spine or the sheep spine studies and saying, well, this is what's going to happen in your body if you bend.
Yeah,
it's unfortunate.
The unfortunate thing is also good studies to know, okay, what positions put stress where, so you can use this as clinical reasoning, like, oh, this is tender and this is aggravated on this person, we're going to avoid this movement a little bit. They take studies where they look at, okay, what do certain positions put what kind of load through certain structures? Okay, rounding at the spine puts more kind of shear forces on the upper lumbar segments. The majority of them, L5, S1 actually gets lower shear forces. But, we'll just gloss over that for now.
Yeah.
But yeah, so maybe there's a little bit more force. And then these studies go back onto that foundation of the pig studies, which is a flawed foundation. And they use that to reason flexion's bad because it puts force through these segments. And if force goes through these segments, they explode, which is a very wrong extrapolation. That is actually kind of made in the literature.
Yes.
Or like some of these studies, or maybe not necessarily the studies, but like the healthcare professionals interpreting the studies and then passing this information
Your
along
spine
to their...
will explode if you round it. It's like a jelly donut, right?
Yeah. There are actual accounts on social media, I'm not naming any names, that have videos of a skeleton with some muscles doing spinal flexion and explosions happening. So that's not going to happen in your back if you round it. But that's kind of the wrongful extrapolations that we're talking about that happen, where it's like, hey, just because there's force going through there, now this idea of your back's going to explode is coming from that, when it's not accurate. It's okay, there's force going through there. You just need to understand that if you keep that within your capacity, you're fine. Yeah. And if you put force through that, that's good. That's how your body adapts. So you let it have some of that force, let it recover. It comes back stronger so it can handle that force and more force later.
Yeah. And again, we don't need to get too sciencey, but a big limitation of those studies is the fact that you're working on dead tissues.
Yeah.
And so they don't, and yes, you're, bending, flexing, all of this stuff repeatedly. That doesn't typically happen in a human in real life. But also, once you finish that activity, these are all living tissues in your body, and they do have the ability to recover just like any other living tissue in your body, right? Certain tissues might have recovery times at different rates that you have to take into consideration, but it's not like you have a set amount of flexion cycles in your spine. Once you hit 20,000 times that you flex your spine, your disc is going to go pop, right?
You're not a car.
Right.
You're an adaptable human being.
Yeah, exactly. If you're working with someone with back pain, how underrated or overrated do you think it is to look at some of those other factors in terms of what is the total amount of volume that you're doing throughout the week, looking at your daily activities, decreasing the load with the weight that you're doing, looking at repetitions? Because a lot of times people are just like, it hurts, do it this way instead, which is fine to put some, take away some of the stress on certain tissues that are maybe irritated. But talk about the importance of looking at total amount of volume and training programs and taking that into consideration for managing back pain and issues.
That is possibly the most important. Like, that is extremely important. Yeah. That load management. And before I kind of get into it, I want to make the point that, changing technique is load management. Yeah. So you're just changing how you're moving to change how much force and stress are going through certain parts of your body, which allows them to calm down and then build back up. So if your knees are painful while you squat and you do a high bar and you go, ATG, just to keep it PG-13.
Yeah, that's fine.
Then maybe switching to a low bar and a more hip dominant squat for the time being, relieve some of that knee flexion, relieve some of the stress going through the knee joint at the moment, some of that force going through the knee joint at the moment, which then makes it comfortable and you can continue squatting and build it up while it calms down. And then you can actually go back to, your regular squatting pattern as that gets more comfortable, or keep it in the whole time and just kind of decrease the load and frequency and total volume that you have with it. But actually looking at the program and changing those factors and variables like, the volume, the frequency, the speed, the range of motion, all of that are ways to decrease how much load or force or stress, however you want to put it, and whatever makes sense in your mind, going through that one area that is painful for you at the moment so that you can let it calm down. And that is going to be one of the biggest factors in your recovery and one of the biggest factors in probably what led to your pain or injury. There was just most likely a moment where, you were kind of going above your capacity and things went wrong and you got injured. Sometimes it's just totally random and it's just how life is and it happens, and you don't need to necessarily say, oh, I was doing way too much of my program, I need to change absolutely everything up. Sometimes it's like, yeah, I was a little bit busy, not quite sleeping the best, doing a little bit more than usual, and I got a little strain. It is what it is, but I don't necessarily need to change anything because a lot of those other variables have kind of changed already, or maybe it's outside of like your full control. Stuff with work, family, having to do a lot of things, and it was just a busy time in your life and it happened.
Life's unfair sometimes.
Life is unfair sometimes.
And unlucky sometimes.
It just happens. That's just how it is. So understand that and move forward with it, and control what you can control. Make things a little bit less intense and chaotic in the moment while it calms down, and then build it back up. But that's looking at the program is the biggest factor, and just changing up your programming is rehab too. So just changing up how much you're doing of something can be rehab. I always like to say, okay, some of the best rehab for squats is squats. Some of the best rehab for running is running. Some of the best rehab for, snatches are snatches, and just like making it within your capacity and then building it up.
Yep. Yeah, absolutely. So don't avoid the thing that hurt you. Because I saw a recent post that you put about this. I'm going to butcher like the specifics and stuff, but oftentimes the thing that hurt you is the thing that you need to work on so that you can feel better and do that thing again. And potentially, even though you've just mentioned sometimes life gets in the way and things can just be unlucky, and you're going to get hurt at some point down the line in life. That just happens. But if you're working on the thing that you got hurt doing, the odds of you getting hurt in the future outside of some of those other unknown factors and things might be a little bit less, potentially.
Yeah, you're building up resilience to that again, right? And really related to this, I just kind of want to talk on this, and it'll help almost bring all of this together, is a framework I kind of use around this, and I'm going to be kind of egotistical here. I named it WMBP framework.
What does that stand for?
What? Modify, break, and progress.
Okay.
So it's like, what's painful? What's your limitations? What can you do? What can't you do? Now that you've identified that, and like, what are your goals? What do you want to get back to doing? Now that you identified all that, you modify the goal activity so that you can do it. So if it's squats, like I was saying, maybe you change your stance a little bit. Maybe you lighten the load. Let's say you can squat 315 comfortably for reps, but only to just above parallel. But you can do 255 full depth, and you want to get back to doing 315 for full depth. So you do pin squats with 315 and up because it's comfortable, and full squats with 255 in the meantime. Yeah. That's the modified movements. Or like a low bar squat instead of a high bar squat, and that relieves some of the pain in your knee, and you can still do the movement and still get the stimulation and still kind of hit that weight and feel good with the movement. And then break is you break the movement down into its component parts. So squat example again, maybe you're doing a leg extension and a hip thrust on it, and just working on like back strength too, so kind of doing some kind of hinging, goes hand in hand with the hip hinge portion of it, and you work on those as well. And the biggest thing is the P, progress. So you progress all those movements as things are feeling good and within your comfort, you progress it. So maybe the full depth squat starts getting more comfortable after week 1 or week 2. You up it to 265. The pin squats are feeling really comfortable, and you have those up to 335, 365, 405, right? And you keep pushing things so that you can build up the tolerance for that movement and build up the resilience. And then that bridges that gap between rehab and your regular training. And then same thing with the broken down movement. So the leg extension, you're just pushing it still within your comfort, hip hinge as well, all of that stuff. You just kind of progress it until eventually now it's regular training and everything feels good. Your full depth squat has kind of caught up to your pin squat, and you can just do regular squats again.
Yeah.
Yeah.
That is like a perfect picture of rehab in my opinion. And I think just based off of the science, a lot of people, like we had mentioned earlier, typically avoid a specific movement and turn to, okay, here's the corrective exercises or rehab exercises. And that's their thought of potentially working with a healthcare provider, right? That's their expectation is, okay, I've hurt myself or I'm feeling pain. Now I have to stop everything, go see somebody who can kind of fix me and make me feel better. And then I'm going to go right back to doing what I was doing before. So when you're talking about progression, I think that's probably one of the most important phases to actually work with somebody who can give you a little bit of guidance and feedback. Because I'm using myself as a perfect example. I'm a walking, talking injury over the last 5 years. I went through my entire competitive sport career without a single serious injury. And then as soon as I started playing pickup sports after university and stuff, just pop goes the hamstring, pop goes the groin. Right now, pop goes the Achilles, just all of this bad stuff. But I am my worst coach for me, because as soon as I start feeling better, as soon as some of the symptoms are gone, what do?
Load it up.
I'm going to load it up to right back where I was before, right? And so when you're doing work with a client or a patient through the progression kind of phase of your rehab model, what are some of the challenges that you have seen come up, and how do you kind of work through those?
So some of the challenges, exactly like you said, just wanting to then load that goal activity back up a little bit too soon, and being just a little bit, too excited to get back to it. Especially when you start seeing some progress and it's okay, things are feeling good. Bam, you're right back into it. Ways I like to address that is changing the mindset around things. So it's, instead of focusing on the goal activity as, okay, you're getting stronger with this movement and this movement is going to build strength. It's, this movement is in there as a way to keep some tolerance and as a gauge to your tolerance. So you're just kind of doing the movement. Not a lot of mental work on it, probably lifting under what you can actually do. And then finding those more comfortable movements with the either modified or broken down movements that you can really push, and just kind of having those at the front of the program at the start of the day earlier on in it, so that you're okay, I can push this and I can feel good about this. And it's now you're hitting PRs again with that, and you're kind of getting jacked up and you're nice, this is feeling really good and I'm feeling stronger. So changing what movements are the focus can really help to, when they're more comfortable movements, can really help to kind of keep that excitement and ego in check with the main movement from pushing too hard on it, and then just kind of going too soon, or too big too soon,
Yeah, absolutely. That's always been my biggest problem, is just going straight back to where I was. So patience is a huge thing, and unfortunately a lot of people don't have it, right? There's a lot of people with the all or none approach. It's, okay, I'm hurt, I'm doing nothing. Okay, I feel better, I'm doing everything, back to square one, right? So the guidance is extremely important there. When it comes to exercises, there's no here's the right exercise to do and everybody should be doing this or nobody should be doing this. But talk to me about some of your favorite exercises, both from this is just fun to do and it's hilarious, and this is actually beneficial for a lot of people that maybe people aren't doing.
So one of my absolute favorite exercises that I think is also extremely beneficial for people that they aren't doing is heavy side bends. Okay. So I love side bends and I love loading them up. And typically when people do side bends, it's 25, maybe less, maybe a little bit more, 35, or a 45-pound plate if you're feeling frisky. Yeah. And that's it. But I mean, the most people could do reps with a 45-pound plate until they're dizzy, right? Just from going back and forth so many times so fast, because it's just such a low load. Yeah, getting that range of motion is nice. A lot of people are so kind of focused on certain movements that don't get as much twisting and side bending, and having some of those movements can feel nice as well as prepare you for a lot more things, and a lot of those awkward positions in, everyday life outside of the weight room, when you're having to lift something awkward and kind of get into a little bit of a side bend twisted position and lift something up. If you have the capacity for it by actually training it heavy, you're probably going to feel a lot better overall when you have to do more awkward things. And they're so fun to just load heavy and rip a 1RM side bend when you're ready. So
I wasn't expecting that answer. I was for sure expecting something a little bit more like conventional, and even like a Zercher deadlift isn't a conventional exercise, but just something that's it's provocative, but it's also like some people do it, right?
Yeah, not so far out of
heavy side bends. That's a good one. And
yeah,
and if I'm being honest, like I might, we're gonna have to do this after.
Oh yeah,
I want to try some heavy side bends.
I do them every Friday, so
within my means, because I have never attempted them before outside of like life, right?
Mm-hmm. Yeah.
So I think that we're definitely
gonna load it up with a barbell, and you're gonna do some side bends.
Perfect. I'm looking forward to that. Any others that you can think of that are, maybe people aren't really even aware of or doing that could also be beneficial?
Just a lot more full range things. Honestly, like a full range pec fly is great for like, shoulders and just kind of being able to handle a little bit more. Behind the neck overhead press, I love those ones, and just kind of, getting you to push in those awkward positions and getting you to be coordinated in those more extreme ranges of motion. And then obviously Zercher deadlifts. I think they're the absolute best deadlift variation, just because I'm good at them. But yeah, tons of fun. And then right in line with like heavy side bends, like heavy twisting. It's just a lot of things where it's like, what you usually don't do, or what you usually never really progress and are seen as like, okay, only go into this with low load. It's like, build it up just like any other exercise. Progressively load it within your means and build it up over time, and you'd be surprised with what you can do. Yep. Like one example is a lot of people don't load lunges super heavy, but we were kind of talking about Alec Blennis a little bit before this. I believe he's hit a 405 lunge, I think, for more than one, or maybe just one rep.
That's ridiculous.
Yeah. And didn't Justin just hit 315 for reps, I think?
Probably, yeah.
Yeah, he's smoking heavy lunges too, and it's like, it's a great movement, and you can load it heavy. You don't have to do it with just a couple
20-pound
dumbbells or like an empty bar or just one plate for 10, 20 reps, right? You can load any movement heavier and build up the strength for it. So not necessarily just an exercise, but more of a mindset.
Yeah. I remember one of my go-to exercises when I was in school, and people will be like, what? Why would you do this? Was literally just heavy barbell Bulgarian split squats. And people just hate Bulgarian split squats to begin with. I always loved them because we did them so much training for hockey. So you get good at something and you learn to love it, right?
Yeah.
But yeah, that was one of my like favorite go-tos, just to rip the legs and feel good about it, right?
Yeah.
But yeah, like they're not conventional movements that you'll typically see in a gym setting, but there's definitely value. And I think it's important. And what we're both kind of agreeing to here is there is value in almost any movement if there's like a reasonable purpose behind it, right? So for example, I always joke around with people who I'm coaching with and stuff. Like I think burpees are so dumb because I hate them, right?
Yeah.
But there's actually like value in being able to just like get down to the ground and get back up again.
Yeah.
You don't have to do it 100 times if you're someone who's learning to get up and down from the ground, but you could find some value in it. And I think you can find value in almost any type of movement.
Yeah. Actually, with a lot of my older patients, I do a burpee.
Yeah.
I just call them get-ups.
Yeah.
I get them to lie on the ground on their stomach flat, and as soon as they're flat, it's like, okay, get up, but you're not doing it for speed.
Right.
You're just kind of doing it like, make sure you're getting into that, a solid lunge position and you're feeling pretty ready and you can get up, right? It's about practicing like being able to get down onto the ground and get back up off the ground, just like you said. And for certain skill levels, it's like maybe you need to do that faster, or maybe you can now push to do that faster and in a more explosive way, and like change how you're getting up, skipping some steps even potentially. And like you said, just understanding the purpose behind it.
Yeah.
So who is needing this purpose? What is their goal and their needs? And then making that exercise fit that.
Yeah, I could like you could almost look at a burpee as almost an outcome measure, not in its strict sense, but if someone's starting with them and they can't go all the way to the ground, or they have to do like this like kind of wide lungy step to get up, and all of a sudden now they're moving smoother and it's looking a lot more comfortable, or they can do it a little bit quicker. It's like you're getting better at doing this type of activity and moving. So
Yeah.
that's almost like okay, we're seeing some progress here in just your general fitness and function and strength, right?
Yeah. Like, oh, now you have the hip range of motion and strength to be able to swing your leg around and get into that lunge and then stand up. Whereas before it's like you had to take a bunch of shuffle steps.
Yeah. So I never thought I would say this, but burpees are good.
It's like on tape.
Yeah, it's on tape.
It's on tape. Save that clip.
We're going to have to rip some burpees after our Zercher deadlifts and our side bends, just do all of those things. Yeah. I guess just there's only really one other kind of point, and it does expand on some of the discussion that we've had, and we can dive into any other topics that you kind of want to touch on too. But this also comes from one of the posts that you put up, and I was completely going against all of my own advice here. So Justin and I had a bit of a segment where we were talking about like the absolute like important pillars and just trying to be healthy, and we both were great at sleep at the top. And I also mentioned that I'm not great at it. Anyways, tangent. I'm lying in bed, supposed to be falling asleep, but just kind of scrolling through some stuff, and I came across your clip of I feel my deadlifts in my back. And it's just like, good. So talk about that, because I think I hear it all the time working with people that are like, no, I feel it in my back. I don't want to feel it in my back when I'm doing deadlifts. There's caveats here. There's reasons why you would or wouldn't want to feel it, but talk about why it could be a good thing.
Because it's getting your back stronger, right? The deadlifts are a back dominant movement. Anytime this is going to shock some people. Anytime you're flexing or bending at your hips far enough, your spine's actually rounding. And you need to have the strength to stand up and get out of that position. Mm-hmm. That's going to happen whether you're trying to keep your spine straight, whether it looks like it's straight or not, right? Mm-hmm. It's going to flex. Understanding that and getting away from that fear of that sensation in your back, or just feeling something in your back, and understanding like, okay, because I'm feeling it there, that just means that it's being used a little bit at least. And that's okay. And that can be a good thing, because now I'm building it up and getting it stronger so that it can withstand this. Yeah. And that's really all that post is about, is like, yeah, you want to feel some things in your back. Yeah. You want to strengthen your back. You want to put stress and force there, because that's how the body adapts, and that's what's going to allow you to handle more in the future.
Especially if that is your goal when you're doing deadlifts. If you're trying to strengthen your back, which like whether you want to or not, you will be. And this is where like you can get into a little bit more of the details in terms of technique. Like if you're really trying to target a little bit more of the hip extension aspect of a deadlift, then yeah, you do want to be feeling it a little bit more through the hamstrings and the glutes and stuff. But if your goal is to get a stronger back, it's not a bad thing to feel a deadlift in your back. Unless you're feeling a tremendous amount of pressure and it's almost kind of scaring you, then that means you've now gone above and beyond what your body is maybe capable of doing.
Yeah. Or you're riding that line, right? And it's like maybe you just need to back off a little bit. Yeah. Do you need to completely stop it? No. Maybe you just need to back off slightly. Yeah. If you're just feeling not great that day, good old auto regulation, and you just take a little bit off.
Yeah, absolutely. Well, okay. I actually think like quite a few of the listeners or people that would be seeing this might not necessarily understand what autoregulation is. So why don't you expand on that?
Yeah. So autoregulation is basically just, judging how you feel while you're doing something, and then changing the stimulus, changing the load, the intensity, how much weight you're doing, reps, sets, volume, everything, range of motion, to match what you're capable of in that day. So let's say deadlifts, for example. I'm just going to use my program. So on my day ones, I do clusters with 270 usually. So I do a single, rest 45 seconds, do a single, rest 45 seconds, do a single, rest 45 seconds, do a single. After one kind of block, I was feeling pretty tired, had a lot of things going on, went in one day, and I was building up, and at 220 kilos, I was like, well, I'm not feeling the greatest, not feeling the strongest. Things aren't moving the fastest. So I changed the load and just did 250 that day and did all my clusters with 250, and they moved pretty much the same as 270 usually moves. So I went, well, this is a good change that I made. It was pretty much the same speed. I was starting to struggle by the last rep still. Pretty much exactly the same that I usually do with 270. So that on that day, that auto regulation 250 was where my capacity is. When I'm feeling better, where 270 would be. So it was like kind of equally matched.
Yeah.
Now, a lot of people always think regulating down, so just kind of pulling things back to be within your capacity, but it should also go up too. So let's say I went in and I was feeling really good and it worked with my program, and I got up and I did my first set with 270. I was like, wow, this was the easiest 270 I've ever felt. I would then put 280 on the bar and see, okay, how does that feel? Is that matching my capacity? Is that where 270 usually feels like? Yes, awesome. I'm going to continue with that. No, it was a little bit overshot. Okay, I'm going to go back to where my capacity is. So just changing some variables to make it more manageable, or if it's not, or if it's very manageable, making it almost less manageable so that it's like challenging you, right? So it's just matching the challenge to where you're at that day.
Yeah, you can't always, you can go in with this ideal picture and program and plan of like, this is what I'm going to do on each of these days. This is the exact weight that I'm going to be going for. In my experience of lifting, almost any time that I've gone in planning to hit a new 1RM, and this is also based on probably just like luck and how everything fell into place. Maybe I had a bad night's sleep the night before. Maybe I was getting too much into my head, because the psychology side of things really affects it. But most of the time when I go in and like, I'm going to do this, it didn't feel good. It wasn't a great day. Maybe I did get some type of new personal best or something, but a lot of times it was an absolute struggle, or I didn't get it at all. And the days where I did go in and hit my personal best, I had no intention of doing that. Yeah. I was just almost winging it. And I was like, I feel so good today. Let's keep going and see what happens.
Sometimes it's just a random Tuesday where you're feeling great and you're like, load it up.
That's
like,
it.
Let's go.
I remember hitting my all-time high deadlift. This was when I was still at CMCC. And I walked into the gym. I don't even think I was anticipating a deadlift, but I saw somebody else doing it pretty heavy. And I was like, I think I'm going to do it today. And it just so happened that like Timber by Kesha came on. And that's my PR song now, just because like it just got me fired up. It's not a good song, but anyways, well, it's kind of good. But
got the blood flowing,
Yeah, exactly. And I ended up doing it, right? So where auto-regulation is a fantastic concept, it does take time to understand what too much or too little feels like, and people just need to be patient with it to understand, especially if we're talking about like rating of perceived exertion or reps in reserve. It's sometimes hard to know what exactly that number is or how I'm feeling on a certain day. So as long as you're patient with it, it's a nice skill or tool to have.
Yeah, exactly. And that's what you just said there is perfect. It's a skill, right? It's going to take time to build up, just like the first time you've done anything, right? It's a skill. You're going to have to build it up. You're trying to learn a new lift, right? Maybe you're new to the Olympic style lifts, new to snatch and clean jerk. You're not going to go in and smash them on day one. You're probably going to feel like Bambi trying to do them. They're going to be everywhere, and it's going to be rough. Some days you're going to, be able to do 40 kilos. Some days you're going to be like, wow, I can barely get the bar over my head because it just feels so awkward, and I'm just like straight raising it up. And then some days you're like, wow, now I'm just lifting 60 kilos all of a sudden with my snatch, and it's no problem, and you're just kind of up and down at the beginning. Same thing with the auto regulation skill. Maybe you completely overshoot, maybe you completely undershoot. That's okay. You just make note of it and say, well, you know what? I was a little bit wrong on this, so maybe I just don't have the best judge of what I feel like. So you can now learn when things are moving or feeling a certain way. Oh, I actually have a little bit more in the tank than I thought. Or, oh, I actually have a little bit less in the tank than I thought. And you can use those triggers from before to learn and better learn the skill.
Yeah, for sure. I know definitely in the gym setting here, especially in like group classes and stuff, like we always joke around about like, you definitely have more left in the tank. Let's go up and wait. But I think it's important for people to understand that you don't always have to progress every session. It can be based off of how you're feeling on that given day.
Yeah.
Right? I think that's really important, because I think that's probably where a lot of people go wrong when they start feeling burnt out, or the ache in their shoulder is coming up when they're benching now, because they were just constantly taking advantage of all the big gains that they were making maybe in the early stages of their strength training that's now starting to plateau and losing that patience, right?
Yeah.
Yeah.
And they're just continuing to push it, or they have a certain program and it says, I got to do this, so I'm going to do this. Instead of being, well, you know what, that's not in the cards today. I need a little bit of a break. I need to tone things down a little bit.
Yeah.
But to go on with the auto-regulating up, I think that is completely underutilized. Like when you're feeling good and just absolutely sending it, I think a lot of people who are like following a program stay really strict to the program, and don't tell my clients this, but sometimes I absolutely love it when they go off program and just like send it. So I'll get, sometimes it's like, yeah, you know, I had 255, just recently I had 255 programmed for one of my clients on bench, and he sends a video and he's like, yeah, I hit 275. I'm like,
that's a
nice.
good feeling.
Yeah.
Yeah.
And he like smoked it at around like RP8. I'm like, perfect.
Yeah.
There we go.
How many like personal records do you think have been just are floating around in some alternate universe somewhere because people just stuck to their program and didn't get a little bit creative or original with it, right?
So many.
I know.
I've probably left so many PRs on the table.
Yeah, absolutely. Because there's the psychology of trying to improve your strength, especially when you're in those like heavier weights. It can be a really good thing or a really bad thing, because sometimes you're second guessing yourself, like, do I really go up by like, maybe do I do a 10-pound jump, do I do a 5-pound jump, do I put just the little itty bitty guys on there? And you know, sometimes you go in and you do it and you're like, I should have put the extra little bit on, right?
Yeah.
And like sometimes it's okay to, you know, you shouldn't be training to failure every single session, because you know that that will catch up to you. But
load management, just like we've talked
Exactly.
about all this whole time.
Yeah, load management. But sometimes it's okay to be like, I don't know if I'm gonna hit this, but you know what, I'll try. And if it doesn't happen, it doesn't happen.
Yeah.
And yeah.
A lot of that can build a lot of confidence with just trying it and being okay with failing, and understanding like, yeah, sometimes you're going to try something and you're going to fail. Yeah. That's okay. You don't always need to hit every single lift. And if you do fail something, it's not the end of the world. It doesn't ruin your workout. It's just, okay, I missed that lift, on to the next thing.
Yeah.
Like, just move on. So it can also really help with getting out of your head sometimes too. If you are someone who sticks to a program for 8 weeks, 12 weeks, and everything's trying to be like meticulous, and then you go to PR and you know you can't control other life factors, and maybe that PR day is not the best, but a week ago you were feeling great, maybe that can help you get out of that headspace and get rid of that anxiety and everything around testing and, you know, trying to set a PR. And it's just like, yeah, when I'm feeling good, I'm just going to go for this. And maybe you hit it and it helps you to not focus on numbers and lifts so much, but just enjoy the process and get better.
Well, we've been talking about load management and preparation for things. So, you know, if I want my back to be resilient, maybe I do have to expose it to flexion and bending and putting loads through it. If I want to build my psychological resilience, I need to challenge it too and feel uncomfortable in those moments. And if I don't ever challenge it, then I'll always be sitting on the side of, I'll just be careful. And maybe I'm missing out on a lot of progress or not hitting my goals because of it, right?
Yeah.
So, yeah, the psychological side is pretty important, I think.
Extremely important for a lot of it, right? And just
Yeah.
like you said, sometimes you got to get a little bit uncomfortable psychologically just to, you know, expand how much you're actually comfortable with.
Yeah.
It can be scary and it can be a little bit fear and anxiety inducing, but you just start off with little bits of it and just kind of push yourself more and more.
I only have a couple of extra structured questions, and then we can probably call it at that.
Then we'll talk about night rain.
I know. I could talk about that all day. But one of them is a little bit more fun in nature. And one of them is useful information, I think, for the general public to know and understand. Might be a little bit boring to you and I, but you're a chiropractor. you're a strength coach, you do a lot of things. With all of this conversation that we're talking about, I think a lot of people's perceptions of working with a healthcare provider, I briefly talked about this earlier, is I'll only go see them if I'm hurt and I have an injury and I can't do anything, or I'm just going to go see them so that I feel better and then I'll just get back to what I was doing. In your opinion, what is your role when you're working with somebody? And like, when can you come into play as a, just not even just as a chiro, but just as a healthcare provider?
Yeah. A lot of the times, yeah, when you're injured, I can help kind of guide you and get you back. But it doesn't need to just be that. Like, my role can just be, you want to learn something more. You want to learn something more about, self-management. You want to just understand more about the body and injury in general. You can see me just for that, for information as well. Maybe things aren't feeling quite the best, but they're not necessarily bad to the point where they're stopping you. And you're like, maybe I'm missing something here. That's another great time when, you can almost get some, I don't say I like help people. I just kind of guide people, give information, and kind of help people understand things a little bit better so that, we're working together. Like, when a lot of the time I see people going to see a healthcare provider and healthcare providers acting as like, okay, I'm doing something to you. I am the one providing the care. I am getting you better. When people come to see me, I don't necessarily view it that way. It's like, we're on an equal playing field. You're the one experiencing something, and I'm just going to work with you to kind of like problem solve, guide you, maybe give you some information that you weren't aware of before that can help you. And we're going to work together to achieve your goals and just make you not only better now, but just in the future too. Be able to better handle everything and be able to just understand more. So my role is just a lot more kind of guidance, a lot of education, and just kind of helping people understand, as well as, maybe you need a little bit of feel good right now. That can all be part of it. If that allows you to do what you need to do to get where you want to be, by all means. Mm-hmm. But that's such a small portion, and it's just, there's so much more potential to help people.
Right.
With like that guidance and everything, which is where I like to focus my energy.
Absolutely. And it's easy for me to comprehend. I'm already biased towards this. We went to school together. We've read the research. Like we understand this, but someone who's just hurt their back doing a specific activity, their first thought process is, I just need to go get somebody to do something to me to feel better. And it's a blessing in disguise if they get to go see someone who's like, well, let's actually get you back to being able to lift the way that you did or do the thing that you did so that that doesn't happen again. This isn't just damage control for the meantime. This is, how do we get you better so that hopefully down the line, all luck and lightning bolts coming down to strike you down a side and stuff, it hopefully won't happen again, right?
Yeah.
It's the guidance side of things. So I think that's awesome that's the approach that you're taking. The last question that I have for you, very not serious. I have failed plenty of lifts in my lifetime. I failed squats, I failed bench, I failed deadlifts, I failed a bunch of other things probably too. What is the worst exercise to fail on in your opinion?
Ooh.
What is the worst failure that you ever had when lifting?
Worst failure I ever had when lifting. I'll start with that one. So it was actually a lunge.
Okay.
So I had actually just done a powerlifting meet the week before, and I was prepping to try to hit a 1RM lunge in a few weeks. Bad load management. I understood this, but I was like, whatever. There was an online competition being held for lunges. I wanted to hit 405. I had already hit 330 for a double. I'm like, okay, I can keep pushing these things. So I did my deadlifts, did my squats, and then I did my lunges, which I usually do. And I was going for my second rep at 140 kilos, so 308 pounds, and just didn't quite have it. Little misgroove and went down, and just the way I kind of went back down, I was kind of losing balance. So I actually fell backwards and missed the safeties and kind of did like a one-legged sissy squat. And it wrecked my knee for like a year.
Yeah.
But I mean, it didn't like wreck it. Like I was still able to work through it and like still competed and still hit a PR and everything. But yeah, there was some pain, and I did something to it. But I understood everything, and I understood the risk going into it. But so that was my worst failure, just because I didn't have the safety set up high enough with it, and just kind of maybe didn't take enough time when I was failing it to make sure that my failure was going in the correct way.
Yeah.
But it was kind of funny.
Yeah. I think that's another kind of almost skill that a lot of people should be good at, is knowing how to fail a lift. If you're going to be only when you're in the territory of I'm doing a lot of heavy stuff in strength training, right? But so like a lot of times I think if you see someone fail a bench press, you're like, oh, that's a little bit embarrassing, and you know, they're just stuck down there with the weight or whatever. But like for me, absolute worst failure, most uneventful thing in the world, a deadlift.
Yeah, because it just doesn't move.
If I squat, people are like, oh, okay, they're seeing the tension, he's going down, he's got that range of motion, he's working through it, okay, and then the bar falls. That's exciting. Bench press, it's like, okay, the guys are helping him bring the thing back up.
Yeah.
A deadlift, it just doesn't budge. You're pulling and pulling, and I remember
I was just doing an isometric.
Yeah, exactly. This is part of my program. I'm sticking to my programming, right? But this was like shortly after I hit my all-time high on a deadlift. And this was not even like a week later, and I'm back in the gym, and a few people are just like, oh, you just hit that? Like, let's like see it again. Like, let's go. And I was like, oh, I'm kind of tired. Somebody gave me one of their belts. I've never lifted with a belt in my life. And I'm just like, okay, this will maybe make a difference. I'll be able to push out against it or whatever. Yeah. And I had 555 on the bar. Not even close to what I had done, like not even a week ago. Obviously, load management. I was very fatigued. My nervous system was pretty fried. And there's this whole crowd looking around watching me because he's, just done this big deadlift. And I go and I pull, and I'm just turning like tomato red. Nothing happens, and I just stop. Nothing happened. Like to me, that's the worst.
Everyone's like, oh.
Yeah, they didn't even get to see like it, go up. The bar bent a little bit, and that was it, right? So to me, like failing a deadlift, that hurt me because it's like you didn't even do anything, right?
That's a good hit to the ego.
Yeah.
Yeah.
Yeah, absolutely. But I think that also kind of puts into perspective, especially when you're kind of working your way up in terms of intensities. We were talking about like load management, good days, bad days, and you're saying, well, maybe I'll go down or up by like 10 pounds. Sometimes it could be bigger than that.
Yeah.
And you shouldn't, feel bad about that. If it's a 50-pound difference, that happens sometimes, right? Especially when you're training at really high intensities. So it just puts things into context of I just kind of got to go with the flow with my body, work within my means on any given day, and stay consistent with things, and I'll eventually see progress, right?
Yeah, some days you got it, some days you don't. That is what it is. It's fine, right? And you just kind of move on. Like I said, like don't dwell on it. Like you said, if it's you just hit 600 pounds and you can't do 550, it is what it is.
Yeah.
Maybe you still hit 500. Awesome.
Yeah. Yeah, exactly. I think that was a pretty solid discussion. I think for anybody who's watching this or listening, if there's anything that maybe wasn't clear, you do have any questions, definitely let us know, whether you're just putting this in the comments or reaching out to us. You can reach out to Kevin here, I guess, as well. I'm just giving them the green light to talk to you, I guess. Maybe you don't want that, but
no, slide in the DMs, kh.movement on Instagram.
Yeah, there we go. We like to hear different questions and topics to know what people really want to learn a little bit more about. Right now, we're just kind of walking through the discussions as we go. We'll definitely be having some more good conversations on injury management. Today was really around the back and deadlifts, but I think we can touch on, you said you used to be a shoulder guy. We can touch on that. We can touch on knees. We could touch on just anything that we really want to. It doesn't even have to be injury related, right?
Yeah.
It just has a fun,
could be a lot of different things. But I think also from our perspective, a lot of these things we've talked about a lot before, and we know a lot more. So sometimes we're not sure of what questions people have and where people are getting stuck up with things. So maybe we've glossed over topics or gone way above certain people's understandings with things. So if something's not clear, it is really helpful to us as well so that we can then provide you the information with when questions are asked, and being like, oh, we need a little bit more on this topic, and what is load management? What is X, Y, and Z, right? Like,
what
you
is
got me
load?
to touch
what
on.
does that even mean?
Yeah, right? Like, maybe that's
Yeah.
lost some people, right? So just ask away.
Yeah.
Feel free.
Absolutely. So if you enjoyed the content, make sure to share this with somebody who you think this would be really useful to. Anytime, I always feel weird saying this, to like, follow, subscribe thing. I'm not used to that yet, but
the classic.
It truly does help any type of traction. We just want more people to learn. We want more people to be exposed to some of this information. So the more that you like, follow, and subscribe and share, the more people get to learn about this stuff. So that's a net positive, in my opinion.
Yeah. If you like the content, you like the content. That helps us, and that helps us get more information out.
Yeah, exactly. So we'll see everybody next time.
Thanks for tuning in.
Yeah.